The last newer anti-epileptic drug we're going to talk about is a drug called topiramate or Topamax. There are a couple of forms available, quick and extended release, and it lowers the amount of stimulation in the brain so that the brain is less likely to respond to something that might cause abnormal impulses. This helps not only with seizures, but some people find it helps migraines too, the Topamax. Got some GI side effects. And this drug is really known for causing lack of appetite. People have ended up losing a large amount of weight when they've been put on this drug at times. It can cause dizziness and drowsiness, can make the person tired, and they can have paresthesias, which are numbness and tingling in their extremities. For adverse reactions, it says watch for decreased seizure activity. That's not an adverse reaction. I don't know why they phrase it this way. You want decreased seizure activity, so you're watching for it. But that's not really a bad thing. It's just something you're assessing the patient for. Actually, decreased seizure activity is kind of a therapeutic reaction. This drug can cause warm, flushed skin. It might cause the heart rate to decrease, and it can cause memory impairment. It's really weird that way. It can make things that you do all the time seem like, you're not really sure if that's correct. Somebody that I know of through another friend was taking it for migraines, and she noticed that she was having trouble as she was driving. Things that she was used to doing all the time, all of a sudden it was like she'd catch herself, like, is this correct? One time she tried to go to Chick-fil-A, and she forgot where Chick-fil-A is. And the thing that really scared her was that she passes Chick-fil-A every day on her way home from work. And she tried to leave from her job and go to lunch there, and couldn't remember how to get there. So she talked to the doctor, and I think they tried something else. But it's really known for causing weird memory lapses. You can see, again, a big long list of drugs that do not interact well with this particular medication. And they're very similar to the drugs that previous anti-epileptic drugs haven't reacted with. We can see, again, drugs for HIV, drugs for TB, drugs for diabetes. So just quite a list of medications that you have to be careful of. It is very important to monitor lab results on somebody on topiramate. You want to look at what their blood pH is. You want to check their electrolytes and make sure they're normal. You want to look at ammonia levels. In some cases, people have started acting funny. And when they've had a whole mental status change. And when lab tests have been done, the patient's shown signs of encephalopathy. And you can read what these signs are on page 175. They have metabolic acidosis. Ammonia levels are sky high. So this has got to be something you warn patients about. It can actually, having encephalopathy for too long without it being addressed can eventually lead to brain damage if unaddressed. And so it's very important to warn your patient to look out for those signs and symptoms. If the patient is on metformin already, which is an oral hypoglycemic drug, that can increase their risk of metabolic acidosis. They should take the drug precisely how it is ordered. And as always, with the seizure drugs, nurses have to ask what other drugs the patient is taking and assess for those. Patient and family teaching on page 178 for Topamax. And it's just extremely important to remember that any anti-epileptic drug the patient has to be weaned from it. You can't just abruptly stop an anti-seizure drug and expect the patient to do well. They can have rebound seizures. So if they're is to be a change made. The patient needs to gradually wean themselves off the drug, and then a new drug should be started.